Hi, everyone. Welcome to today's Career Chat. I'm Krista Harmon. I'm one of the Career Readiness Consultants with the Kent Intermediate School District, and I'm so glad to have you here today. We'd like to especially welcome Christine Fuhman. She is an ultrasound technician. Welcome, Christine.
Hi.
We're so glad you're here today. I know the students love learning about careers that they may not know about. So before I hear about what you were thinking in high school, why don't you just give just a quick synopsis of what an ultrasound technician is? And of course, we're going to dig deeper into that, but some students may not know what that is.
Okay, so with ultrasound, basically we use sound waves to see inside the human body, looking at different anatomy. It's a safer modality than X-ray or CAT scan because we don't use radiation, we use sound waves. So we're kind of a first screening tool. They jump to us before they would use a CAT scan if they can to look for appendix, things like that. We look at a variety of things from head to toe, different organs, babies out throughout pregnancy. We do vessels, we do heart. So it's a wide variety of field options with ultrasound.
That's great. So you said it's a radio frequency? Is that what you said?
Yep.
Yeah,
Yep.
okay. Good. Well, I look forward to learning more about that. So Christine, these students that are on the call today, most of them are in high school, 16, 17 years old. Did you think you'd be an ultrasound technician when you were in high school, or how did you figure out this is what you wanted to do?
No, when I was in high school, I had no desire to go in the medical field. I don't do blood, any of that. And when I was in high school, when you thought about medical, you thought just about nursing. You didn't really know about the CAT scan, X-ray tech stuff. So when I went to college, first I went for psychology. So I worked with women and children of domestic violence, sexual assault for several years before I decided to go into ultrasound. That was a later in life career choice.
So when you were in high school, you thought, oh, I want to go into psychology, and then you went and got a 4-year degree?
Yep.
And so you worked in kind of that psychology field, helping, like you said, women going through really difficult times. What changed? What happened in your life that you decided to go back to school?
It was I had children of my own, and it was a lot of, it was stressful, emotionally stressful, and I needed to be there for my kids in a different situation. So I just went into healthcare field. I worked part-time. I always worked part-time since I went into ultrasound. So.
Well, it's good for young people to hear that, decisions that they make early on in their life, it's not like you can't change. So you decided that some of the subject matter you were dealing with was pretty heavy, and you had your own kids, and so you just needed to separate from that. How did you decide on ultrasound versus being like a dental hygienist or some other type of 2-year program? How did you make that decision? Did you do some job shadows or talk to people?
Yeah, I did do some job shadows, and then my local community college had a program at the time. It was way back before we had Grand Valley and stuff. They had the programs now. And so I had talked to an advisor there, and she was telling me about it. And so I did some job shadowing and decided to go ahead.
So at that time, was it a 2-year program for you at the community college?
Yeah, I did. It was like an articulation agreement. So I live up in Greenville. So I went to Montcalm Community College, and then I had to finish up at Jackson Community College. So I had to do some traveling and some virtual classes as well.
So when you got into it, help the students understand what kind of training is involved. Is it all book work? Do you get to be hands-on? Tell us about the training.
You have some book work, you do some prereqs like you do for most, and then it's like a program. So you would apply to the program just like you would like a nursing type program or any type of specialty like program. So you get your prereqs out. You do have to have a pretty decent GPA, and you go into a 2-year, most of the programs now are 4 years, but you have your 2 years of prereqs, and then you have usually a 2 to 3 year ultrasound program. So you do a lot of physics, a lot of anatomy, and then you have scan labs because you have to learn how to scan. And then you do a year, usually around a year at a hospital, doing different rotations to different hospital settings because different hospitals perform different scans. So just to try to get yourself familiar with what's out there and get trained.
So they get you actually doing it versus just you have to start actually doing it to learn. So it's pretty hands-on.
Yeah, it would be very difficult to learn without having the clinical rotations.
Yeah, and I think that's part of this program, Christine, is for young people to kind of hear those things because everyone has a different personality or the way they learn. So for some young people to know that they can learn hands-on like that, and that it is a hands-on job in general, could be a really positive thing for them. So
Yeah.
when you think about a typical day as an ultrasound technician, I think some of us think it's only babies, but like you mentioned, it's all sorts of body parts inside. So kind of take us through what a sample day might be like for you. What kind of things you see?
Okay, so I'm a general sonographer, so we do a variety of things. So today, for example, I had a lot of abdomen. So we look at kidneys, gallbladders, livers, aortas, vascularity in the abdomen. We look at female reproductive, male reproductive. We look at thyroids, soft tissues, lumps, bumps, things of that nature. So it's a good variety most days.
And are you looking for, is this cancer that you're looking for? Or what kind of things are you looking for?
Well, it just depends on the area. Thyroids, we're looking for like thyroid nodules or anything that looks suspicious that they might need a biopsy. Because with anything, you know, it can look suspicious, but we don't know what it is till we put a needle in it. You actually have to do a biopsy on it. So we look for areas of the body that, you know, might require a biopsy. We're looking for like fatty liver or any kind of liver disease, gallbladder, gallstones, kidneys, kidney stones, or hydronephrosis, which is backup of urine into the kidneys, female organs, cysts on their ovaries, torsion, which is twisting of the organs on the vessels so that they don't get a good blood supply. So it just depends on which organ we're looking at and what their symptoms are, what we're actually trying to diagnose for them.
And like you said, you're kind of the first line. So if someone's having an issue, you're one of the first tests. And like you said, if they see something, then they're going to go in maybe with a needle to do a biopsy or a scope at the next level, MRI. So, yeah. And is it like pretty fast paced then? Do you have people coming and going all day?
Yeah. We have full schedules. Our normal typical schedule time is we have 45-minute blocks, and most exams take anywhere from 20 to 40 minutes. So you have a few minutes in there, you have paperwork, and you got to get the patient's history, you got to end the exams, get them over to the radiologist, because we don't diagnose, we send them over to radiologists, which are the doctors who are trained to read ultrasound, CAT scan, diagnostic imaging type studies. So we have to get everything ready and send over to them.
And what kind of doctors are those that you send those to? Are those radiologists?
Radiologists, correct.
Radiologists. Okay. One of the students is wondering, do you do ultrasounds when someone comes in for a trauma?
We can, if they're like for lacerated spleens or something like that, we could get called to the ER a lot. It would be more for fetal demise. So if a woman's pregnant and she's bleeding, so we get that kind of trauma. We get what I talked about earlier was torsion. When you have pelvic organs like ovaries or testicles that twist and they don't get a good blood supply, then that's an emergent situation that has to be fixed within a certain number of hours so they don't lose that organ. So we get called down to the ER for those types of things.
Yeah, I was just kind of spelling out what that infant demise was. It was when a baby passes away inside, which is, yeah, very traumatic. So you deal with some pretty difficult things. You said that you don't get to read them, they go on to the radiologist. So how do you keep your face because you probably started to learn what looks normal, what doesn't? How do you handle that when you know it's something really bad and you can't say anything?
Well, depending on what it is. So like with breast ultrasounds, when we're scanning for breast cancer, we have a radiologist on site. So a lot of times we'll go get the radiologist to come and talk with the patient so that they don't have to leave without knowing, you know, they need a biopsy or something. You just have to try to keep your game face. It's hard some days. Some days you go home and it's rough. But then there's so many positive things too. There's the good days and the bad days with everything. But it's nice to know that even if you do find something bad, you know, people are looking for answers. They're there for a reason. They're having some kind of symptoms and they want to know what's going on. So, you know, you're part of that process. And if you can catch something sooner and get them treated sooner, then the better outcome for them. So there's the positive, you know, you kind of just have to spin it.
Yeah, one of the students would love just a little more information about what makes good days really good, and what are, obviously when you have a mom that has a baby that passed, that's a bad day. But
Yeah.
what are some of those good days or anything else you want to share about just the bad days so that they have a realistic expectation of what this career is about?
Yeah. So for the most part, I mean, you are just helping people diagnose. You're just helping them find out, you know, if they come for right upper quadrant pain, that they're having a gallbladder attack. They've been sick for years. Well, you're helping them find out, hey, this is a problem that can be fixed, you know, and they're happy then, you know. It's when it's like the unknown. I feel crummy. No one can figure it out. Well, you're helping them figure it out. When you do that, then they're happy. It's like, oh my gosh, thank you. I've been having this feeling for so long. And so just being part of people's health plan is good. And then, you know, you do get the OBs that aren't the fetal demise, and you get to show them, and sometimes you get to tell them, hey, you're having twins, or, you know, there's a lot of positives.
That's great.
I have great coworkers.
Say that again.
I have great coworkers. I have a great team.
Yeah, tell us a little more about that.
So we just, with our sonographers here, I think we have maybe 24 or 25 of us now. We have a pretty big group. We have some that are just at the offsites at the OB offices that just do specialty OB all day, every day. They don't come to the hospital. So we all just kind of have a niche what we do, but we have a great team. We do take call on the weekends. We take call on holidays. So, you know, you have to be pretty flexible with your schedule, but we do have 24-hour coverage. So like, I'm a day shift person. I don't work third shift typically unless, you know, someone requested off and they ask you to help out or something. For the most part, you pretty much, at our hospital, you have your standard shifts that everybody's assigned to. So you pretty much know what your schedule is going to be. We help each other out. We need time off.
That's great. Taking a call, like just to let the young people know, that's, tell them what being on call means.
So being on call is just, you have your phone available, and if someone, right now we have a Saturday girl. She works every Saturday and Sunday, but she has a full schedule. So if we have an emergency patient in the emergency room that needs an ultrasound done, then they would call us in to come and perform that, because she doesn't have time to get those done. So they want somebody there who can get there within 30 minutes and get those exams performed so they can get that information and get that patient taken care of.
Yeah, so that's pretty common in the healthcare field, correct? To have certain jobs that have on-call off hours.
Yeah.
Yeah.
Yeah. Anything where you're going to be involved in an emergent situation, they're going to have people on call.
You had mentioned, obviously, ultrasound is one of the front lines of healthcare, the first tests. What are some of the other types of ultrasound or radiology or CAT scans? Tell us about some of the other in your field of what's called diagnostics. You're making a diagnosis. You're using this technology to help understand what's wrong. Tell us more so the kids can learn about what else is going on.
Yeah. So with diagnostic imaging, we pretty much have your routine X-ray, which they're probably all familiar with that, I would imagine, but just radiographs, broken bones, things of that nature. And then ultrasound, which we've kind of touched on that. And then you have CAT scan, which is radiation like X-ray too. But that also does cross-sectional through the body to diagnose a variety of things as well. And then you have MRI, which is a magnetic imaging, and that sees things. They all see things just a little bit differently or in a little bit different detail. So that's why the different modalities are used for different structures. And then there's also called nuclear medicine. So there's several different imaging tools in the radiology imaging department.
Okay, so those are all under the umbrella of radiology.
Yeah, diagnostic imaging. Yeah, they call it the radiology department, but it's diagnostic imaging. Yeah.
Okay, and just for the young people, I will try to continue to get people in these different specialties. But as far as you know, Christine, are they mostly 2-year programs as well?
Yeah, I'm not. I think like MRI, I think is a lot of it used to be if you trained in X-ray, you just cross-trained, and that's how it used to be for CAT scan. And I think maybe CAT scan still is, and even mammography is you're an X-ray and then you do some special training into mammography. But MRI and nuke med are their own specialty programs now. I'm not sure with nuke med, that might be a 4-year program, but I think the MRI is a 2-year program.
What I want young people to know about this too is, you know, when we look at our futures, college debt is a really big thing. I mean, it's a reality for your generation. And these are 2-year programs, you guys, and they make good money. So it's really, I really want to encourage you to consider these kind of jobs. And once you're in there working, you may find out about something else, just like Christine was doing a job and then it was, you know, became something she didn't like. So she changed into it. So there's no reason not to start with a 2-year program and get yourself into a hospital and start to learn, and you might just love it and stay there forever, or it could move to something else. What have you seen, Christine, as far as what other things might evolve from a job in radiology?
Well, I have several friends who've left radiology and went into different types of management. Some go on to PA school, physician assistant school, after they finish their ultrasound degree and worked a few years. Sometimes they work for us like on weekends or, you know, nights or whatever, so that they can take their classes. We have a girl right now going on for her master's in, I think, biochemistry or something along those lines, but she started in ultrasound and just wanted to continue her career path, but she wanted to be making decent money to support herself while she did that. And the thing about working at the hospitals, it does have a variety of hours, so it's one of those jobs you can kind of work around and still make some money while you're trying to finish your education and something else as well.
Now you work at Metro Health, you have University of Michigan Metro.
Yeah.
Do they have tuition reimbursement?
They do. I couldn't tell you what it is off the top of my head, but yeah, they do have some tuition reimbursement programs. Pretty much
Yeah.
anybody who works here has that option.
Yeah, I want to put that out there also for students, because again, you can get into a 2-year position, a 2-year training. GRCC has quite a few of these training options, and it's so less expensive than a 4-year degree. But then once you get in as an ultrasound technician, for example, you could continue to go to school on the hospital's dime. So again, you wouldn't have to incur any other cost for any additional education you wanted. So I just wanted you to know that, so you can think about strategy of how to pay for this kind of stuff. You know?
And I know some of the hospitals have agreements with some of the colleges too, like ours happens to be with Davenport. So we have some kind of a specialty tuition thing with our hospital in Davenport. And I can only speak for Metro, not anybody else, but it's good to know.
Yeah.
I mean, they have.
Absolutely. All the hospitals in the area have it. So definitely something to check out. This is a great segue, Christine. One of the students wants to know if it's difficult to master the equipment. And I know that you had pulled up an image that you maybe wanted to show the students with your camera. I don't know what you'd like to share there.
All right.
Is it hard to learn?
Well, it can be, but it's doable, because I will tell you that I went later in life and I was very teachable, and you are all young and smart and very, very teachable.
There you go.
So, can you see, this is my platform here.
Yeah.
So we have a lot of knobology, we call it. So we have to pretty much learn to master all these buttons. They all do, and then all these buttons do different things depending on the settings that I have on. We have transducers, so you select different transducers depending on the body that you're gonna, the body area that you're looking at. And so we have, it's all shades of gray. So that's my thyroid up there. Can you see it?
Yeah, we can see it.
Okay, so this is my thyroid gland. And then this is all muscular tissue. You got my esophagus and trachea. Well, trachea right there. Can't see my esophagus in there, but so basically you're just training your eyes to see different shades of gray. And it is difficult. It seems difficult at first, but it's like looking at one of those pictures that you don't get it, and then aha, you get it. And then it's not as big as the deal as you think it is. So just differentiating the tissues just by the shades of gray in the images. So
It's like learning a new language, right? You practice your words, all of a sudden it clicks, and all of a sudden you just understand it that much better. It takes training, yeah. And I think that's what I want to encourage young people, that you learn it. That's part of what your schooling is. Just like, you know, the first time you bake a cake, you've never done it and it seems complicated, but then once you bake a lot of cakes, it's not a big deal anymore. So same with this, you just practice, and then it's good to go.
And then we have several students who just, when we get them, you know, early on, they're like, I'm never going to learn. I was that student. I mean, I thought there is no way. And then here I am, our clinical instructor. So now I'm teaching the students. So you will get it. And there was a lot of physics, and I was not good in math in high school. And I'll tell you what, you can do it. If
I have heard that physics is, if you like physics, that this would be a job that you might really enjoy. Tell us why physics is part of this.
It all has to do with attenuation of sound, and the different knobology has a lot of physics involved. So if you increase your depth, what's it to do to your frame rate and all this stuff? And it's all has to do with making your image diagnostic. So it's all the inner workings of the machine now. You don't have to think as much about it as you had to back when I started. So it's a little bit easier. The machines are all preset on stuff. So you just have to get through your physics classes. That's it.
That's it.
Don't ask me physics now.
I'm sorry, go ahead, say that again.
Don't ask me physics now.
Yeah. Well, you've probably seen technology change, like you said, in your career. Tell us about what some of the latest, greatest things in technology around diagnostics is happening.
Well, with ultrasound in the last several years, it's been the 3D, 4D imaging, the live 3D, which is basic, or 4D, which is your live 3D. So when you are doing, babies on the table with mom, they can see kind of that baby moving in real time. It looks almost like a real little person, that you can actually see. And then just with the equipment, it's just the better technology. So we can see things that we didn't used to be able to see just because the imaging is so much better. So it's always changing.
Have you heard any about new innovations on the horizon that you've been reading about or hearing about?
Well, they've been talking several years about like contrast or bubble studies injections with ultrasound, but some places are doing that. We haven't started doing that, and I don't know, if or when we will. But then there's things called elastography, which it's kind of the stiffness of the tissue. So they want to start doing that more with ultrasound. They're finding out that if they can just do that, it's a special program inside the machine, but if they can use that, then it saves people from having to go through like liver biopsies sometimes, because depending on the density of the tissue, they can do more diagnosing than just actually having to do an invasive procedure with a needle, which can lead to infections and things like that. So anytime they can avoid something like that. Things along those lines. Yeah.
So you mentioned that part of your career path now, you, like I said, you did in psychology, then you're in ultrasound, now you're one of the instructors. What have you noticed that are qualities or personality traits or just even values that make a good ultrasound technician?
You really do have to have empathy for your patients. I mean, we do see some really sick people, so you need to be able to deal with that. You need to be able to I can't think of the word. It just escaped me. Compartmentalize. There it is. It's a big word for me to say right now. Because you do have to take some of that home, but you have to be able to let it go too. I think you kind of got to be kind of an outgoing. I mean, not that there's not introverts who are ultrasound techs, there are, but you just need to be able to set your patients to ease. You need to be flexible. Mm-hmm. Hospital work, you have to kind of just be flexible.
Yeah. Because things at some level, even though you have appointments all day, there's probably things that change. You have to kind of roll with the punches on some things.
Mm-hmm. Yep. Definitely have to be able to do your critical thinking. You have a patient on the table, you see this, and then, okay, now I see this. Now where do I go from here? What else could be going on? If this is going on here, what else could be going on someplace else? So those types of things.
What about high school students? Do you ever have high school students come in for job shadows? What could they be doing now if this is something they think they might be interested in that they could take as a next step?
I always encourage job shadows just because, there wasn't a huge opportunity when I was in school and I didn't know what was out there until I was there. So if you think healthcare, call your hospitals, ask, can I tour the radiology department? Can I tour the OB floor? Whatever you think you might be interested in, don't be afraid to make a phone call. It's just a phone call, and most hospitals or healthcare settings or whatever are more than excited to have students come through, show them a little bit about, they're our future. So we want them to learn. We want them to be excited about the career paths. So
you may not know this, Christine, but Metro is very special that way. Do you know that you're the only hospital in Grand Rapids that has a formal job shadow program?
Oh, I did not know that.
Yeah, so I'll talk. Yeah, so students, if you would like a job shadow with Christine, if you go to Metro Health, Grand Rapids, Michigan, their website will come up and you can put in job shadow, and they actually have a formal process of forms that you have to fill out, and then the person in charge will connect with someone like Christine to let you go through the job shadow. Mercy Health does not allow job shadows at all. And Spectrum Health, you have to know somebody who will then start the process. So if this is something you might want to do, I'm really excited to have Christine, but they're one of the few hospitals that actually does job shadows. And we're always working with our hospital partners to get more of it, but yeah, it's pretty limited actually.
You're gonna know. You just don't know.
Yeah.
Too bad.
I know. So I'm really grateful that Metro has their program. So
me too.
As we finish up, we just have a few minutes left. I guess I'm wondering, when you look around at your job and your career path up to this point, is there anything would you pick a different career? Do you love ultrasound? Tell us, this is your chance to kind of sell it. What do you love about ultrasound versus maybe if there's something else that you think is pretty cool too?
Well, I kind of touched on some of that earlier, the good and the bad days, but no day is ever the same. You're not going to get bored. It's just different. Every day is different. You have different patients on your schedule all day, every day. You get to meet tons of new people. I've met some awesome people. People bring their phones in and show me their kids that I had this patient 10 years ago, and then they come in and I get to see some of their lives as they go on, if they come in for like routine stuff. So it's good.
Yeah, because that's one of those personality things. Because like an ER nurse, for example, he or she may not see that patient again, right? They come in that one time. Maybe a dentist office, you see your patient every 6 months, you can build a relationship. Long-term care, you get to see them every day. So
Right.
I'm really interested to hear that you actually have some patients that you'll see more than once. So you get to know them a little bit.
Yeah, we have people that come in, oh, I have a thyroid nodule, so they come every 6 months, or they have a cyst on their breast, they come in every 6 months, or things of that nature. So not all your patients are going to be that way, obviously, but you get some.
Well, that's great. Students, I guess that's part of that self-assessment, when you think about what kind of environment you would like to be in someday. So students, you have a chance for one more question. I'm going to show the slide. I forgot to ask Christine, if they had a follow-up question, do you want me to, is it okay to give your email, or do you prefer them to go through me?
Absolutely. No, that's fine.
Okay. I'm going to share that then. Christine, your last question will be just kind of a final word of wisdom. So I'll let you think about that for a minute as I share some quick resources with them. That's how we'll end up here. If this is your first time to a career chat, I wanted to let you know about a great research tool called onetonline.org. And it has all sorts of the information about ultrasound technician, that what a typical day is like, what kind of money they make, if it's a growing job or going away. This is a same type of tool, mynextmove.org. It's just kind of got a different visual, so it's kind of easier to use in some ways. I plugged in the word ultrasound and it came up with these other categories. So this will be good for you to go there and read about the differences, right? What the difference between a sonographer, an ophthalmic, medical technologist, the radiologist. Just wanted to put that out there. That's something that you can check out. And here is Christine's email, if any of you are interested and want to follow up. I don't know if you can hear bad feedback. I've been having bad feedback on my voice. I hope that doesn't record like that. I'll let you write that down. Notice Christine without the H. And again, my name's Krista Harmon at kentisd.org. And this will be recorded. It is being recorded and will be put on our website. So you can catch that stuff again. But Christine, you've been such a great role model. You've really helped us understand what this field's all about. What's kind of a final word of wisdom for these young people?
I guess don't let physics or any of those things scare you, because I'm telling you, I was not a math wizard, and you can get through it if ultrasound or, don't let anything hold you back from what you want to do.
That's great advice, guys. I love that. I'm going to stop recording just for a second here.